Having a healthy pregnancy is one of the best ways to promote a healthy birth, and two of the most important factors in preventing complications during pregnancy and after the baby arrives, receiving both prenatal and postnatal care. Joining us live right now is Erin Bane, certified nurse midwife at Windham Hospital. Erin, welcome.
Hi, thanks for having me.
This is so important. So what is prenatal care and why is it important?
Well, prenatal care is that bunch of visits that you have to go to with your provider throughout your pregnancy, right? They start off slow and then they speed up at the end. And they're all pretty important because we do a lot of different assessments during your pregnancy. We do imaging, we do lab tests. And so even though it feels like we're just making you come back all the time, it's pretty important to do all those visits.
All right, talk about why postnatal care is just as crucial for mothers.
Yeah, postnatal care is really this unsung hero in our care. There's movements now to make it more than what it is right now, but for most people, all you get is 1 6-week visit, and it's really an important visit where you've got to pack in a lot of questions, you've got to pack in a lot of assessments, we've got to pack in just a lot of information to make sure you and your baby are doing okay at home. At the postnatal visit, I check your body to make sure it's ready to do things like go back to work, to exercise, to go back to having relations with your partner. It's all really important part of our assessment. It's also a great time to check in with mood. We know now that a lot of mood changes happen after you have a baby, and those can be really normal or they can be maybe not so normal. But a lot of people try to, make all those feelings what are supposed to be happening, and we really like to get in touch with that to make sure you don't need counseling or medication even to support you as you adjust to your new life with your baby.
Right, because a lot of women don't even know there's a lot of help for postpartum. All right,
yeah.
For those people unfamiliar with postnatal care, can you explain what happens during these visits?
Yeah, it's mostly a chat when you come to see me. We talk about how you're doing with your baby, if you've decided to breastfeed your baby, how that's going, how you're feeling about your baby, how you're feeling about your partner, how you're feeling about the way your family is adjusting to this new person. I check in to make sure all of your body is kind of going back to normal, right? Having a baby is a thing. Everybody thinks the baby just comes out and maybe your body is just fine after that in a few weeks. And that's true of most people, but some people need a little extra help or a few extra visits to make sure everything's coming back into place. I make sure that, you're not leaking urine, right? So a lot of people think that's okay after you have a baby, but it's, and it can be okay for a while, but we want to make sure we get it under control in different ways. And so that's just an example of the things I check in with.
Okay, and some quick, in 15 seconds, get a lot of sleep before and after baby, some other things real quick.
Eat as well as you can, drink a ton of water, move your body. Don't start out by running a marathon, but move your body and check in with your body, listen to it to make sure you're not doing too much. Call your doctor if you have any questions. When we say we're here, we really are.
All right, Erin Bane, keep up the great work, certified nurse midwife at Windham Hospital. Great advice. Thank you so much.
Thank you for having me.
Next at noon, dad and daughter, doctors who perform heart surgery together. Their story when we come right back.